One of the first things many women want to know postpartum is how and when they can begin exercising their core postpartum. Understandable, because the core is the part of the body that changes the most during pregnancy. If you want to know how to activate your core postpartum in a way that's safe for your pelvic floor, keep watching. If this is your first time here, my name is Sydney. I'm a perinatal athletic therapist and postnatal fitness specialist. Today I'm going to walk you through how to activate your core in a way that is safe, creates stability, and doesn't place excess pressure onto the pelvic floor. Before we get into the nitty-gritty of core activations, we need to do a little bit of an anatomy lesson. This will help you to understand why we activate the core the way that we do, how it helps to stabilize our intra-abdominal pressure, and why this method is more safe for our pelvic floor. My dog just came to join us. All right, on to anatomy. This is a photo of our core. When I talk about the core, and when many practitioners talk about the core, we're not only talking about the muscles of the abdomen. We're talking about the entire space, or it's often referred to as a canister, from the thoracic diaphragm down to the pelvic floor, and from the spine all the way around the front in 360 degrees. Many people refer to this area of the body, the core, as a pop can or a canister, because when this area is in neutral and everything is functioning as it should, it is extremely strong and stable, and every muscle around it can work as efficiently as possible. Take a pop can, for example. When there are no kinks in a pop can, it is extremely strong and it's very, very, very hard to crush. But if we were to put a kink in the side of it, like this, it's much more easily crushed. I'm not going to go into detail about each muscle of the core at this moment. Here's a picture for you if you just want a reference. The muscle we're going to focus on today that is part of the abdominal muscles is transverse abdominis, and I'll explain to you a little bit more later how this muscle comes into play. Instead, I want to talk a little bit more about intra-abdominal pressure, what it is, and why it's important that we maintain it. This little GIF or however you're supposed to say it shows this intra-abdominal pressure management really, really well. When we take a breath in, our thoracic diaphragm actually drops down. When our thoracic diaphragm drops down, our pelvic floor actually also drops at the same time. If our pelvic floor doesn't drop and it stays elevated as the thoracic diaphragm continues to push downwards, the amount of pressure that's being placed onto the pelvic floor increases with each breath that we take. This inability to relax our pelvic floor can come from many different things, which I'm not going to dive into today. So if you have been diagnosed with a hyperactive pelvic floor or one that won't relax, this is going to be one of the things that you're going to want to watch out for. Our deepest core muscle, transverse abdominis, which I just showed you a moment ago, has neurological connections to the muscles of our pelvic floor. This means that when transverse abdominis activates, so does the pelvic floor, and also vice versa. If the pelvic floor is activating, transverse abdominis often is as well. Do this exercise with me and you will be able to feel how your transverse abdominis activates along with your pelvic floor. You're going to want to find your lowest ribs and kind of place your hands just below your lowest ribs and push inwards into your abdomen. Next, I want you to take a nice deep breath in. When you exhale, Kegel. Feel what's happening underneath your hands. If you didn't quite get that, do it again. You should feel a little bit of a tightening that's happening right at the sides of your ribs. This is the transverse abdominis that's activating. It activates kind of like a corset and it wraps around from back to front. So that just goes to show you how transverse abdominis, which is part of the abdominal muscles, is connected to the pelvic floor neurologically. So sometimes if we are activating our core when we're not even thinking about it, or activating our pelvic floor when we're not thinking about it, the other one is also involved. I would advise, if you are going to do these core activations, make sure you are at a place in your healing process that is going to be safe for you and not cause any secondary complications. I would recommend, if you are not seeing a perinatal or pelvic specialized orthopedic therapist, wait until your 6-week appointment with your practitioner so that they can clear you for exercise and you can begin learning how to activate your core. Anything prior to your 6-week appointment with your practitioner, especially if you aren't seeing a specialized practitioner or orthopedic therapist, could cause secondary complications. So we want to make sure we stay away from those as much as possible during the healing process postpartum. I would recommend if you are before 6 weeks and you are not seeing a specialized practitioner, feel free to just breathe. Just do the breathing exercises. You will be on the right track when you get to the 6-week mark in order to begin with the core activations. How do we activate our core in a way that's safe for our pelvic floor? It's not the same thing as activating our core as if someone's gonna punch us in the stomach, because watch what happens when I do that. My entire torso goes into flexion, which means I'm not staying in neutral, and that can or canister is not staying in neutral or being maintained. When we activate our core that way, or when we brace our abdominal muscles, we're actually not activating that transverse abdominis, which wraps us around this way. It's a lot more of our rectus abdominis, which is that six-pack muscle, and it more so just flexes our torso. So how do we do it properly? This is a little bit of a process and it has quite a few steps. I'm going to show you each one and then I'll have you practice them on your own.
You're going to begin on your back. Take a deep breath into the lower belly, and we're aiming to feel our pelvic floor relaxing. I've done a video on this previously, which I'll link here or down below. Once you feel that pelvic floor relaxing, we're going to shift that breath into a wide rib breath or diaphragmatic breath. So place your hands at the sides of your ribs, and we want a nice wide breath on our inhale. If you're having a hard time with the breathing, don't worry about it. Just stay here for a little while longer. But remember, we want to avoid that breathing that's happening up in the chest. We want to focus it down to the outer ribs. Great. After we've got that breath down, this is the tough part. There's a lot to think about here, so try not to get frustrated, but I'll walk you through it. For a deep core activation, we're going to begin with a deep diaphragmatic breath into the outer ribs. Then as we exhale, we're going to think about zipping up a onesie from back to front and from bottom to top. So nice deep breath in and allow that pelvic floor to relax. As you exhale, begin a Kegel, then slowly draw your belly button towards your spine and slightly up towards your ribs. And remember, this is not a big grr activation. This activation is very minute and it should feel like it's stabilizing your entire core from your spine to your abdominals and from your ribs down to your pelvis.
So that's a core activation. It's a very simple activation, but if you've never done it before, it may take you a little bit of time. If you're having a hard time, give yourself a little bit of grace, practice each step individually, and then try to bring it all together. One thing I want to point out is if you start to feel a tension or a soreness that comes approximately at your mid-back, don't do quite as many of these activations. Come back to them a different time. This is a new muscle that you're learning to activate, so it may take a little bit to get used to. If you're having a hard time, don't worry. Go back to the previous step. Try that step a few times. When you're ready, advance to the next one. If you caught on quickly and this is a pretty easy activation for you to do, feel free to try it with some simple exercises. Something like a light hip hinge, standing up from a seated position, or something of the sort, and then slowly build on that. Like I said, this activation is going to teach you how to keep your entire core from thoracic diaphragm down to the pelvic floor and from back all the way to front. It's going to teach you how to keep that entire area stable, specifically while exercising. And we're going to make sure we're always maintaining our intra-abdominal pressure and not placing excess pressure downwards onto our pelvic floor. If you liked this video or you learned something from this video, make sure to give me a thumbs up below. And if you'd like to stick around and learn more about perinatal therapy, postpartum exercise, or anything of the sort, feel free to subscribe and stick around. Once again, thanks for joining me, and I'll talk to you guys soon.